Okay, we're going to go ahead and get started. Hi, everybody. My name is Mary Jane Burke. I'm the Marin County Superintendent of Schools. I'm really happy to welcome you here this afternoon. Let me just go through a few housekeeping things. For you to be aware that this session is being recorded and will be available to you within about 24 hours. You can find it on the Rethinking Schools website. So that's number one. Number two, this is being simultaneously broadcast in Spanish. So thank you to Marta Baton for being here with us. So you'll be able to, it will also be then recorded in English and in Spanish. Wanted you to be aware that many of you over the last several days have actually submitted multiple questions to Dr. Santora. And just to note, if you don't hear your exact question, please know that we've tried to group them together so that we can try to get to most of them. So we will try to get to most of the questions. In addition, if you have a question during this session, if you could put it in the chat, a couple of my colleagues will be monitoring that as well. So at this point, Dr. Santora, thanks so much for being here. We appreciate it very much. We know how important this parent handbook is. We appreciate you, your schools team, along with our school nurses who have worked so hard to put this information together. And you all on this call can also know that you could find that online in English and Spanish as well. So Dr. Santora, I'm going to pass this on to you. Thank you very much.
Thank you, and thanks right back to your team for getting us prepared for today's event. Everyone has earned their Master in Public Health as we reviewed the parent handbook together. And I'm going to provide an overview of the handbook.
Sorry, I apologize to interrupt, but there's a question in the chat making sure, wanting to know whether or not this is being translated live in Spanish. So the answer is yes, absolutely to that. If you do want to listen in Spanish, you have to click the language interpretation icon that looks like a globe, and you'll be able to hear this in Spanish. Sorry for not clarifying that. Sorry for the interruption.
No worries. I'm from Jersey. We interrupt all the time. My children have learned that too, but I'm trying to parent better. So I just want to thank everyone on and all of our schools team, the Marin County Office of Education, as well as all of the school districts, private, public, independent, parochial schools that have been working with us to inform the development of this handbook. We know many schools have started, and as always with COVID, the world is evolving very rapidly, and our commitment to the handbook was making sure it had all of the information and was up to date based on the best practices available. And as everyone knows, we've been learning a lot, and especially with the reopening of schools across the nation. So that being said, I'm already promising another update. We're going to jump to the next slide where I'm going to provide an update on our tier status. And the handbook that is available now is been specifically designed for tier 1 and tier 2. Those are the levels where it's determined that COVID-19 activity is widespread or substantial. And so we anticipate moving to tier 3, where we will be identified as having moderate COVID-19 activity. And that will allow us specifically to relax some of the requirements for the evaluation of students with symptoms that might be consistent with COVID-19. So Dr. Willis is reviewing that decision tree as I talk right now and is updating our public health advisory. And that will be the first public document that has information around how to evaluate students with symptoms while we're in tier 3. And that will also be updated on our website. I think there's more people to thank, but again, thanks to our school nurses and to our nursing team in public health, and to all the parents and to all of you. We're only here because we've all worked so hard and stayed vigilant and stayed the course, which is allowing me to share the good news. The next slide, so you can jump ahead. So I know this isn't the best picture. We'll work on getting better graphics, but I just wanted to share with you. It's not posted officially on the state website, but we have entered and met the indicators for the first time to enter tier 3 or the orange tier, where there is moderate activity. And so if you look at the first picture on the corner of the blue and the red lines, that just shows how California is testing. And then you'll see Marin County testing exceeds that. And because of the high level of testing in Marin County that we've had since the beginning, it allows us to adjust our case rate. And we have a case rate now less than 4. That's the next picture right to the side of testing. And that actually less than 3.9. And that is what allows us to be classified as orange. The state will not confirm our status as orange until we demonstrate 2 weeks in a row, maintaining the levels in the positivity of our tests, which you see we've always kept our positivity percent positive tests less than 4%, which has been in the orange tier. We've always held in the orange tier for that. And we've actually been less than 2% and less in we're approaching the yellow tier, which is tier 4. And then in the final picture in that bottom corner is the equity index measure. And this is us demonstrating that we've made the investments in the census tracts that are identified as the lowest quartile on the healthy places indicator. So our most vulnerable census tracts also have low percent positivity. So it's showing that Marin County is making investments to ensure equity in our response to COVID-19. So it's not official. I jumped on the website before I went online today with you guys, and it's not official yet that we are in orange, but we are expected that this will be our first week in orange. You'll also see that what happens in orange is there's more relaxation of the occupancy generally that's allowed. So for example, in gyms, we'll see their occupancy rate increase from 10% to 25%. We'll see indoor pools will be allowed. And what that goes back to is almost the third point on the third bullet on the previous slide is, as things relax, we really need to stay on guard and focus on our own personal protective behaviors to ensure that not only do we reopen schools, but that schools don't close because of our own voluntary behaviors. And one voluntary behavior we're encouraging everyone to do is also to get their flu shot. It's the one tool that we know is safe and effective for protecting us against the flu. We are anticipating, if we look at the waves that we're seeing in Europe, that we need to be prepared that there could be a second wave of COVID activity right in the middle of our flu season. And that could absolutely cause a surge into our healthcare system. So we can continue working together by visiting your healthcare provider and driving through the Kaiser Flu Clinic and getting your flu shot today. So we can jump to the next slide. So here it is, it's official. You can go online, the Student and Family Handbook. It's available in Spanish and in English. We are encouraging every parent to read the entire handbook. For parents who are like me and only can read 2 pages, we have an introduction page that is 2 pages of introduction and an overview that is bulleted, but we absolutely encourage everyone to read through the full document and understand our expectations. Again, this is us working together, and there are tremendous parental responsibilities for guardians and to ensure that we maintain a safer school environment. You can jump ahead. But there are bullets for the fast readers like myself. So I just want to focus first on, again, how parents and families can work together to keep schools open. Our teachers and staff have done an amazing job of getting schools ready. I was on my elementary school campus and saw letters that were spacing children 6 feet apart, preparing for kids, how to navigate kids and maintain physical distancing when kindies and second graders are coming onto campus. And so our staff and teachers have done an amazing job, and now it's our responsibility to take on the challenge of staying vigilant and engaging in safer behaviors so we prevent an increase in COVID activity in our community. And the first one that I hear that I know is the most important one, because I see this as driving an increase in COVID-19 activity in our community, is gatherings. We are all ready to socialize and be together with friends. We have Halloween and Thanksgiving and the winter holidays upon us. And that's typically when we gather multiple households together. And this is a time where, under the state guidance, gathering more than 3 households is prohibited. And so, for example, this weekend, my parents came and visited my family, and that's 2 households. So just because we're related doesn't mean my parents are a separate household. It's 2 households that are gathering. So really, this is one of the most important strategies that we have moving forward into tier 3 is really reducing our social activity and limiting our household gatherings. The second one is the number of cohorts students are involved in. And so the first cohort, it's not your household, it's not considered a cohort. The first cohort a child would be involved in is their classroom. They're going to be back in in-person instruction, and that's their cohort. Some children like mine participate in an aftercare program for childcare, and that would be considered their second cohort. We're not considering, again, the household or bus transportation a cohort, but it absolutely would be part of our case investigation and contact tracing if we do identify a positive case. And we're strongly encouraging that families limit to 2 cohorts. And specifically, we identify 2 because we know many families have multiple children in their households. And so you could have 3 children who each have their own 2 cohorts, and all of that increases the possibility of exposure to COVID-19. So that is why we're strongly recommending no more than 2 cohorts. Again, working as a family and teaching your children why we physically distance and the importance of physically distancing. It is not the nature of children to physically distance. It's not the nature of us as adults to physically distance. So really working with them so they understand why we're maintaining more space than normal and why we're wearing face covering, and really working with our youngest children to get them prepared to wear face coverings when they go back into the school environment. Hand hygiene, everyone's been slacking. We're all very good at washing our hands in March, and I know I'm among the worst of them, and I have to talk myself through washing my hands for 20 seconds. Hand hygiene and face coverings are our real strongest tools in personal protective behaviors to prevent the spread of COVID-19 transmission. So working with your kids, role modeling good hand hygiene, and sending them back to the bathroom when you hear the faucet only go up and down for 2 seconds. And then lastly, but not leastly, is not sending children to school sick, not pre-medicating kids with fevers or other symptoms of a respiratory illness, making sure they stay home. And as well as if there's someone else in your household who appears sick and you suspect they should be tested for COVID-19, not sending your children to school if someone is being evaluated for COVID-19. These are ways that we can prevent the closures of these cohorts or classrooms when we identify that there's been a possible exposure. If a child has a known possible exposure, if someone in the house is getting tested, if that child stays home, we can prevent an unnecessary closure if that person does test positive in the household. So again, it's looking at your whole household as we prepare to re-enter into school. And you can jump to the next slide. So you're not going to be able to read all of this, and I'm not going to go through all of this on this slide. We tried our best to have a visual description of how to make a decision on how to have your children evaluated for symptoms while we're in tier 1 and 2. Again, it's important to note that this is specifically for these 2 tiers only. We will be releasing a decision tree for tier 3 that Dr. Willis is reviewing and approving now, but this is what will be leading us in at least until next week. And we need to be prepared that we might relax our requirements, and if we go back and have higher levels of COVID-19 transmission, we will return to this tier 1 and 2 decision tree. And so I'm just going to orient you to the tree itself, and then we'll go through some specific slides to help you, again, when you have time at home to review the tree, it'll make sense to you. So on the left-hand column, you'll see just the symptoms that are associated with COVID-19. We categorize them as less common symptoms or more common symptoms. So a child with one of the less common symptoms will have one pathway, and we'll review through that. A child with more common symptoms will have a different pathway through the decision tree. The next column is what is the disposition of the siblings and other household members. So there are conditions where we would recommend that a sibling, even if they're not having any symptoms, stay at home. And we definitely appreciate this is a burden to families. But this is as we reopen school and have our largest school districts begin to reopen, this is a way we are taking a more conservative tact in ensuring that we can minimize COVID activity in the classroom. So that's the next column, is that disposition. The next column after that is, what are you to do? Are you to get a COVID-19 test or to see a doctor? And then we help you navigate what are the outcomes of either being tested or seeing a doctor, and what are the next steps to return your children back into school. So I know it's busy. I'm sure everyone will get comfortable with it, and we look forward to hearing feedback from everyone out there to see how we can potentially simplify or clarify as we move forward. So we're going to jump forward to the next slide, and then there'll be time for questions, but we'll hopefully get through some of the details so you can, again, it'll make sense to you when you get home and read this. Or you might already be home, because most of us are working at home now. So, so this left side of the decision tree are the symptoms. So we identified those less common symptoms. So this has been a tough one. There's a lot of kids with runny noses, and just normally as like the regular cold, you think, but runny nose is still a symptom at this phase that we would like to have a healthcare provider evaluate that child. You don't necessarily have to go in and see a doctor, but you need to have a telehealth visit or a phone call with your doctor, and for the doctor to do a risk assessment to determine if they need to be tested for COVID-19 or not. The more common symptoms, which are listed in that blue box, which include fever and cough, especially the loss of taste or smell, which we're seeing really is a very specific symptom for COVID-19. Those more common symptoms must receive a COVID-19 test and have a negative test in order to return to school. And we've, I think it was one of our nurses created the phrase test or 10. In this scenario, if you do not get tested, we are going to assume that you have COVID-19 and treat it as such, and you'll have to isolate at home for 10 days. And so for these specific symptoms, we are requiring testing for COVID-19 in order to return to school. Again, I appreciate this. My children have been tested, I think, 4 times this year for fever. It's fortunately, testing is becoming more widely available. We're very concerned and want to ensure that families that have more challenges accessing healthcare also have access to testing. So we have been partnering with Marin Community Clinics and our other federally qualified health centers to ensure that everyone in Marin has access to a healthcare evaluation and access to testing. And so we can jump ahead. So this is what I was referring to, that the second column is determining what to do with the siblings in your household if someone presents with symptoms. So if anyone in the house just has the less common symptoms, the siblings and household contacts do not need to stay home. They can go to school. But if anyone in the house has more common symptoms, the siblings and household contacts need to stay at home. And again, we appreciate that this is a significant burden, but while there is substantial COVID-19 activity in the community, we're taking this conservative approach in the schools, again, not only to support the reopening of schools, but to keep schools open. Importantly, we've had scenarios here where there's been a known COVID exposure. So a great example is a high school student is notified that one of his or her friends has had COVID-19. If that high school student can quarantine, so they are able to stay in their room and isolate from the rest of the family, that's the definition of quarantining. You're not tested positive yet, but you've been exposed. Then the other family members who are students can go back to school. There are circumstances in our community where a family shares a bedroom. And so if a family shares a bedroom and the student cannot quarantine and stay apart from the other students in the household, then the other students need to stay home. And again, we appreciate this is a burden for families, especially as we're trying to navigate the complexities of getting tested and evaluating the symptoms. But for us, considering that we want to get tens of thousands of students back in school and keep tens of thousands of students back in school, we're going to take this conservative approach while we're in tier 1 and tier 2. And I just want to pause there and say that this is under constant evaluation. And when we learn more from research and data, if we can be more relaxed, let's say we move forward to orange and then move forward to the yellow tier, and then there is a wave that brings us back to a red tier. Before providing guidance to schools and parents, we'll make sure this handbook is updated to reflect the most current research and data regarding school-based transmission. Okay, so we can jump ahead. So this has been a question for many. What is the definition of a close contact? And if you are a household member, and this is where we see most COVID-19 transmission occurring, it's within households when people aren't wearing face coverings, that is considered a close contact. Or if you've had a gathering with someone and you know that you spent more than 15 minutes with someone and you were less than 6 feet away from them, sitting across from a table for more than 15 minutes, having lunch or dinner with someone, with or without a face mask, that would be considered a close contact. And then close contacts of people with known COVID positive are placed on quarantine. And we have a team of our public health investigators who work with every case who is identified in Marin County to identify, have them notify us who are individuals that they would identify as having close contact during their infectious period. So you can jump ahead. So this is just another definition of the difference between isolation and quarantine. And when we share these slides online, you'll be able to click to the links that provide those definitions as well. So quarantine is for those individuals that we're trying to separate. They haven't been confirmed as having COVID-19 yet. They've been exposed to COVID-19. And that is a way for us to limit that transmission or spread of COVID-19. Isolation is when we separate someone with confirmed disease, so we know they have COVID-19, and we separate them from others so they don't get other folks sick. And so with isolation, it's a 10-day isolation period. That may change, but right now it's 10 days. That's deemed to be the most conservative approach to isolation. So 10 days from the start of your symptoms or 10 days from the date of a positive test is deemed to be your isolation period. And then your close contacts, and this is the hard part for many, the person who's sick can often return to work or school sooner than their close contacts, because the time starts for those who are close contacts from the last day they had contact with the infectious person. And from that day, we count forward 14 days. And so that is the duration of our quarantine period, is for 2 full weeks. And I'll say it once here, and I'm sure it's on another slide. We do recommend, especially in the school environment, that close contacts of individuals with COVID-19 get tested 5 to 7 days after their known exposure to COVID-19. So we don't recommend testing right away. There's not enough time for your body to replicate virus, or for the virus to replicate in your body. So the recommended time for testing is 5 to 7 days after the last contact with a COVID positive person. And then this is the hard part again. Even if you test negative, if you're identified as a close contact, you need to complete that 14-day quarantine. Because even though we've tested you as negative, we have seen many cases where after someone tests negative and after they've had a close contact with a COVID-19 positive person, that they may develop symptoms later, or they still may be in their infectious period. What this testing allows us to do is determine if there's any other cohorts that need to be closed, or if you do test positive, what are the additional public health actions that we would take, again, to protect the school environment. So you can jump ahead. How to return to school. So if you have only one of the less common symptoms that are listed, you need to contact your healthcare provider, and we're only asking for communication. So we're working to make it easy for your provider either to call, fax, or send an email to the school and say it's okay for your child to go back to school. Another way back in is a copy of a negative COVID-19 test. You may schedule a test yourself for your child and get a copy of that test, and your child can go back to school as long as they're improving with their symptoms and they are fever free for at least 24 hours without fever reducing medication. So this is the bullet point I had before, was that you can return, if you had a close contact with a COVID positive person, you can return 14 days after that last contact. And then again, even if you test negative, you need to complete the full 14-day quarantine period. And then if you're COVID positive, you can return 10 days after the onset of symptoms, or 10 days after your positive test if you're asymptomatic. And then you also need to make sure you have 24 hours without a fever and without using fever reducing medicine. And again, if you have one of the more common symptoms and you do not get tested for COVID-19, we are going to call it a presumptive COVID-19 case, and you still need to isolate at home for 10 days prior to returning to school. Jump. When Marin moves to tier 3, and I'm cautiously optimistic it's going to be October 27th, but that will not be confirmed by the state until next week. We will adjust our protocols and relax some of the restrictions. It really depends on us. It depends on our behaviors, where we stay, which tier we move to and which tier we stay in. So really encouraging, again, families as we reopen schools to heed our public health guidance. And to limit social activity, limit the number of cohorts your children are participating in. And then we will look at the guidance and update in the handbook and update it appropriately as we move back into higher tiers if we do experience a second wave of COVID-19 activity in Marin County. So this is the we're in it together slide. We really are. We very much in our team see how it's individual and group actions that drive increases in COVID-19 activity in our community. And we are just encouraging everyone to work together with us. We know it's hard. We know it's been months where we've not socialized, we've not gathered like we normally would, and our children have been suffering. And there's things that we can do together, and we just need to be cautious how we do things together. Right now, the weather is great. So when you do gather, try and gather outside as much as possible, really limiting that social activity, limiting the participation of your kids in some of those activities, and then really working at home to help them wear face covering well, help them engage in hand hygiene and respiratory etiquette, because that's going to create an environment where our staff and teachers can feel confident that they're in a safer environment and that they can focus on teaching, which is what we all want to do. So we can do this. And so thank you for your time today, and we'll jump to answering all the amazing questions that you've asked. And then again, we'll try and make sure we're also developing on our website a frequently asked question location as well, so we can keep those updated for any questions that we don't answer on today's phone call.
Okay, great. So Mike, do you want to go through the questions on the chat?
Yes, Mary Jane, I will do that.
Thank you.
And we had a special request from our translator. Thank you so much, Marta, to just have a brief pause after the question so that she can translate the question before trying to hear the answer.
Great.
So, there's a significant number of questions that came in advance, and there's been some great questions that are parallel that have come up in the chat. So I will go to the one that's right in front of me here. The decision tree for more common symptoms, a doctor's note. Oh, I see. A doctor's note will do, but you're saying that it's test or 10. If someone has more common symptoms, it's test or 10, or is a doctor's note sufficient?
All right, so if you have one of the more common symptoms, you need to be tested for COVID-19 while we're in tier 1 or tier 2. If you're not tested, then you need to stay home for 10 days with those symptoms. The exception would be if a doctor provides an alternate diagnosis. But again, we've communicated with many of the healthcare providers in the community, and most of the symptoms that we're seeing in those more common symptoms really do require testing, or at least a risk assessment to determine if there is no risk for COVID-19. At this point, while we're still in tier red, again, I just had my kids tested. It's hard for a clinician to determine if a fever and a sore throat is just an old URI without a COVID-19 test, which is why we're requiring the test and requiring requiring that they isolate at home for 10 days.
So Mike, there's a question here specific to Tam High School and the air filtration there. That question isn't one we'd be able to answer here. Lisa, would you be able to answer a question or your comments about college students, for example, who are currently at college out of the area coming back to home for Thanksgiving? Your thoughts about that and what steps should be taken? And then do you consider that families have travel restrictions over the Thanksgiving break? So that would apply to the holiday in December holidays as well. So could you talk a bit about that? So the question of my kids in college, they're coming home. What do you believe the steps are that should happen?
All right, so for returning college students, it has been seen to be a higher risk environment. We've had a couple cases in Marin specifically where returning college students have been notified that they have been exposed to a COVID positive case. And so I would just encourage families with returning college students to have them monitor for symptoms, stay connected with their school to receive notice if they have a known exposure. We do have a public health system intact in all of our states. And so most close contacts, if their names are given, will be notified. And then also just to talk to your children, they're not children anymore, young adults returning to your household to see if they were engaging in higher risk behaviors like larger parties and larger gatherings. And if they had been to really monitor for symptoms and maybe not necessarily a full quarantine, but really trying to separate them from maybe younger children. If they're engaged in higher risk activities, separating them so we don't have to exclude your younger child from school in our community. Mm-hmm. And then on to the second question regarding travel. We're not discouraging individuals from travel, it's how you travel and just knowing which risks and that you would be taking. So if you're traveling, really trying to limit the number of households you're traveling with. We do see the larger number of households that mix together. They'll be, especially when they come from different parts of the country with different restrictions on face coverings, et cetera, that you have different risk of COVID-19 activity. So when you travel, think small again, and ensure that you're practicing the protective measures that are recommended. So if you're traveling on a plane, depending on where you travel, you may be required to have testing. You'll need to wear face covering on a plane, or you should. If there's tremendous evidence, again, that face coverings are very valuable at protecting you. And then when you land at your destination, to keep it small, follow our public health guidance that's in Marin County. So when you return back to Marin County, you just haven't eased up your own vigilance. But there are we're not requiring a quarantine of anyone who goes out of state and returns into Marin County. Just think about practicing safe behaviors when you're out and about.
What if you're immune compromised and your healthcare provider doesn't want you to get a flu shot?
Well,
don't get one.
So we absolutely would defer to a healthcare provider's recommendation for a flu shot. Usually individuals who are immunocompromised, most doctors want immunocompromised individuals to get the flu shot because they're at the highest risk for hospitalizations and poor outcomes due to the flu. There are certain medical exemptions that do exclude individuals from getting the flu shot, but generally healthcare providers recommend flu shots, especially for older adults, younger children, and those with chronic conditions like diabetes and other immunocompromising conditions.
Mm-hmm. Several questions about testing in general. When do you see that students will be able to be tested on a regular basis, as opposed to just trusting each other to do the right thing?
Well, I think it's important to remember that testing, all of the testing available is for emergency use authorization only. And so these are all new testing technologies that are available to us. For most tests, the best test is when you have someone with we call it, this is our fancy lingo, but Mike Grant knows this word, a high pretest probability for having COVID-19, meaning you have one of the symptoms or you have a known exposure. And that makes that test result much more reliable. When we're using tests for screening, it's less reliable. The reason why we're not recommending universal screening of students is one is because children under the age of 18 have a lower prevalence or likelihood of having COVID-19. They're at lower risk. And so the pre-test probability or likelihood of them having COVID-19 is low, which is why we currently are not recommending that. We are recommending surveillance testing for staff who are considered essential workers. And so we have support from the state and support from our healthcare partners like Kaiser for offering testing for those essential workers who are out in the public. But we really think most teachers and staff can really minimize their risk of COVID-19 by simply following those guidance where they're trying to maximize physical distance when possible, wearing their face covering, engaging in regular hand hygiene and appropriate respiratory etiquette, and staying home when they're sick. So at this time, there's no recommendation for universal student screening because we don't have a great tool for it. And again, the likelihood of it being COVID-19 is lower in students at this time.
There's a question about what's respiratory etiquette.
Oh, when you cough, it's not what my son does. It's when you cough into your elbow is respiratory etiquette. It's a lot easier now with people wearing face coverings when they sneeze, etc. But we still would recommend someone who sneezes or cough to still cough into their elbow, the vampire cough. That's respiratory etiquette. And hand hygiene is really the full 20 seconds of washing your hands. It's not the under and just the rub. It's really making sure you're washing every part of your hands. And if you're doing it right and you're washing all parts of your hands, all surfaces, it should take 20 seconds.
So Lisa, there's questions here about there's a few that are interrelated. If a student tests positive, who has been in classroom-based instruction, does the entire classroom go into quarantine for 14 days? And for those students who go into quarantine, how can they continue their learning? And I will say that one of the, from the school side, students who are required to quarantine who are not sick certainly can engage in distance learning. That the classroom's not closed; it just reverts to distance learning. But can you confirm that that's the case?
So if a child in a classroom tests positive, then yes, at this time in the pandemic, we would close the classroom and consider all children close contacts. That is a very extreme measure that we only typically have used in measles. And so this might change, but at least at this part of the school year, we will be closing that classroom. The child will be sent home for 14 days. And what I'm hearing is there's really different variations among schools and how schools have set up their instruction to support distance learning. So yes, the child would be excluded from schools. Some schools will have, my battery's running low. Some schools will have real-time virtual learning that happens so students can just zoom into the classroom and see what's happening in the classroom. Some schools are on split schedules and that's not going to be supportive of that. So Mike, you're going to take a question you know the answer to why I get something to charge my battery.
Okay. So there's a question here with regard to are there going to be changes made to the decision tree regarding common symptoms and accepting a doctor's note? And my understanding is the decision tree as it's written right now is for tier 1 and tier 2. And when we move to tier 3, there will be changes made both to the handbook and to the decision tree that will be less restrictive.
Yes. When we move into tier 3, we're going to align more closely with the CDC, Centers for Disease Control and Prevention, definition of COVID-19. So there's specific symptoms that we call them typical symptoms of COVID-19. That's cough, shortness of breath, the loss of smell or taste. We're going to be calling those high-risk symptoms and that they need to get scheduled for a COVID-19 test. And then we're going to identify symptoms if children have 2 or more symptoms of, and this is in the CDC definition. So they have fever and a sore throat, then they need to get scheduled for a COVID-19 test. And this will all be in the updated handbook. But if they only have one of those symptoms, so in the scenario where my children just had a fever, they had no other symptoms, they just woke up with a fever, they would be able to return to school when they're fever-free for more than 24 hours and wouldn't require a healthcare evaluation. So that's going to be the biggest difference, is the requirement of a healthcare evaluation. And so again, we're hoping to get this posted as soon as tomorrow, where you can see. But right now we're in tier 1 and tier 2. So it's really, again, the most strict, most conservative approach. And that's, again, we want to create an environment where teachers and staff many have been out of school and not on campus, really can feel safer returning to school, knowing that we're having a conservative approach. It shifts the burden again to families, and we'll relax it as we move into tier 3. But at this point, based on the current research, we think this is the best approach.
And Lisa, the earliest we could move to tier 3 is October 27th. Is that accurate?
That's correct. So we need to have 2 weeks in tier 3, orange, maintaining our indicators in orange. I haven't seen it. I don't believe it until I see it.
Right.
I'm optimistic we'll post this week orange. Looking at the data, we anticipate that we should be on track for 2 weeks in orange. And one of the data that we have available is, some people saw, we called it a test-a-palooza in the San Rafael, in partnership with the San Rafael City School District. That was primarily driven because of the canal area being an epicenter of our COVID-19 activity. And we just completed analysis. We have an amazing epidemiologist, Karina Arambola, another mom on the phone, who is completed data. And we now have the percent positivity in the canal area is 4%. And that's amazing. It was at a high of 40%. So there was a point when we were testing in the canal, all the tests were 40% of tests were positive for COVID-19. We're now down to 4%. So we really do believe we're at the end of that first wave of COVID-19 activity in Marin County. Everything can change, but that's where we are for now.
So Lisa, this is a question that came in before this session. With the new addition of someone in a household exhibiting symptoms of COVID-19, does this apply to office settings or just the school setting?
This applies to the school settings. Again, the school would be considered a higher risk environment. That being said, we're not seeing significant evidence of school-based transmission at all, but it's the gathering of children from different households. So we want to take, again, a more conservative approach. And so that is where a student exposed to someone that has symptoms consistent with COVID-19 at this point, while we're in tier 1 and 2, needs to stay home. But that's not requiring that their parent not go to work. It does require that the person who's symptomatic should get tested. So there is a difference between how we treat COVID-19 in the school environment and then how our recommendations for the general workplace. And as we learn more and as we see locally that there's a limited school-based transmission as we reopen, again, we'll use the data to inform any relaxation of our guidance and our recommendations.
Lisa, there's a question here where someone would like to know if you'll be providing a bibliography with the science that supports the strategies outlined in this presentation.
Oh, sure.
Okay.
I'd love to provide a bibliography.
Okay, so if there is,
we'll work on that as a team.
Yeah,
Our primary sources are peer-reviewed journals, Centers for Disease Control, World Health Organization. We also look to San Francisco Department of Public Health and Los Angeles County Department of Public Health. So we truly rely on peer-reviewed journals and emerging research to form our decisions. And more importantly, sometimes the local data. We have more than 100,000 student days at this point, and we still only have one suspected child-to-child transmission of COVID-19. And this is when we includes July, when we were at our highest rate of COVID-19 activity, and which reaffirms that we see schools as a safer environment. But again, we want to be conservative, so we build the confidence of school staff to return.
Mm-hmm. Hey, Mike, I'll send back to you, but let me just ask this question. It came up in the questions, but also again now. Will schools fully close if we go back to higher tiers? So let's do purple, red, orange. And so my understanding, Lisa, is that you would not go backwards. Is that correct?
Correct. We are not anticipating school closures due to what tier we're in. Schools that have opened will be able to remain open in any tier at the level that they were open to. And the reason behind that is that the schools have been able to demonstrate the implementation of best practices and the safety measures to prevent the spread of COVID-19 or to contain COVID-19 activity. We expect COVID-19 to enter school campuses. It has. It's how we contain it and how we respond to it. And that those are the measures that we are taking with the closures of cohorts and having some strict measures around how kids can enter school. So you're able to stay open as far as you were open. So if a school district only had opened up to middle school and we moved back into purple or tier 1, they would not be able to open high school. So they only can keep it open at the level that they had opened to. That being said, we do need to prepare for school closures. We're doing our best to quickly identify and quarantine any close contacts and close cohorts. But the state has given us guidance if we have a certain percentage of the student population who contract COVID-19, that we would have to close a school. And so those would be guidance, that would be a different guidance that we would be following based on COVID-19 activity within the school. And that's consistent with what we do with measles or other contagious diseases as well.
Sorry, let me just do this one more. Is it prudent to bring kids back before January, knowing that we're coming up on flu season and the holiday break?
Absolutely. We have demonstrated, again, we have more than 100,000 student days where we have only one suspected student-to-student transmission. We have no suspected student to staff or staff to student transmission. And we have demonstrated that we can open schools safely and for the well-being of our children and adolescents in this community, especially those most vulnerable, where there already is an educational attainment gap. We believe we can safely return to school if we work together, if we all get our flu shots, if we limit our social activity, if we limit gatherings and limit the number of cohorts our families are participating in, we can keep schools open. And so that being said, we always are ready to adjust and change, and we need to always consistently be ready to adapt and change. What we're seeing in Europe is a second wave that's not causing the same levels of hospitalizations or fatalities, but that could be different in the United States. So we are driven by data and trying to provide the best guidance we can with the current information we have, but we do believe it's the best time for kids to go back to school.
So, Lisa, this is kind of central to the parent handbook. And I felt like you covered it really well in the presentation, but it's sensitive. It's a sensitive topic, and I think bears reiterating. The question is, many families need daycare. And I don't understand that a sport or extracurricular activity will need to be cut to ensure the safety of everyone. This goes to the two cohorts question. There's the classroom and one other thing. Can you just reiterate or restate that?
This is a hard space, and this might be something we reevaluate when we do enter another tier, but it's a slippery slope, especially if you have more than one child in your household. The number of cohorts they're participating in increases their risk of exposure to COVID-19. And I completely empathize with families. My children are in aftercare themselves and also go to school. And we also are striving to normalize and provide them with the personal development opportunities that sports and other activities provide for them. And so I think this is one thing we will reevaluate. It's our best recommendation at this time, again, to think small as we reopen our largest school districts. It's a strong recommendation. It's not an order. And I think it's something for parents just to consider as they're making decisions and re-entering into the in-person learning environment. And again, part of the thought around that is exactly that. There could be three students in a household. They all have two different cohorts. And as we know, as the older they get, the risk will be higher because of the exposure possibility with larger size classrooms and cohorts. And so this is just an effort for us as a community to think small together.
So, Lisa, thank you. So, Lisa, there was a wave of initial schools that went back in early September with a waiver, and then on about October 5th, there was a second wave of schools, public schools, that went back about October 5th. And the question is, how's it gone so far for those schools that have started on October 5th? What if issues have arisen, if any, from the public health side?
I think it's gone very well. We have every day, we have more student days where we don't have COVID-19, we don't have school-based COVID-19 transmission. We have identified cases in the school environment among staff and students that we've been able to respond to and close cohorts appropriately and in a timely manner to contain COVID-19 activity, and again, have not had any additional transmission in the school environment. So I think it's going really well. What we are seeing again are those voluntary decisions that families are making that place students and schools at risk. So allowing parties and other events outside of the school environment is what threatens to close down schools. And so I know it's hard. I know kids will be kids. We hear often, but these are the decisions that we need to make together to keep schools open. So that is our biggest concern going into Halloween and going into holidays, is that everyone's not going to be paddling in sync and limiting those gatherings and talking to their children about why we're limiting it. And this year is different because we want to keep these schools open.
You think it would be a good idea for all students to get flu shots as a requirement to return to school?
We strongly encourage students to get a flu shot. We aren't issuing an order that all students get a flu shot. The UC system did implement an order for students and staff to get that flu shot. Dr. Willis and I are just using every opportunity to strongly encourage parents. We're so thankful again to our healthcare partners for making flu shots widely available. We had a great flu shot event this weekend in the Canal area in partnership with Marin Community Clinics. And that's our role in public health, is making sure these resources are available to all in Marin, but we will not make it a requirement. Strongly encourage.
Lisa, there's another question. Have there been any instances of child to teacher transmission?
There have been no instances of child to teacher transmission. The only incident of school-based transmission we had was between a preschool to preschool student. And they were not wearing face covering and obviously not practicing social distancing, that's not possible when you're 3 years old. So, and both children had very mild symptoms or only symptomatic for 1 to 2 days.
So Mary Jane, there's a question that came in from the interpreter from the Spanish families about, is there any data about the risk for a child with Down syndrome? Are they at higher risk of contracting COVID-19?
They would be potentially at higher risk because they have other complicating conditions, and as they age, children and young adults with Down syndrome may age with cardiac conditions that might increase their risk of exposure to COVID-19. But again, special education was one of our top priorities of returning special education students to school, because they so depend and their families depend on that in-person learning environment for their health and well-being. And we've not had a student transmission of COVID-19 in our special education learning environments, and where they can be, and I understand, are much more challenging environments for practicing physical distancing and wearing face coverings. But again, individual families might make decisions based on their own child's risk of COVID-19 exposure to return to in-person classroom education, but we believe we can provide a safer environment that supports the health and well-being of all children in Marin.
What does the data say about student to teacher transmission outside of Marin?
Universally, child to adult transmission appears to not be a significant driver of transmission. It's primarily adult to adult transmission in a household setting that is the primary driver. If you look at the percent of the population that are children in California, they represent, they have a lower representation of COVID-19 cases. So for example, children under 5 are 5% of our population in California, but they only are 2% of the COVID-19 cases. And we're consistently seeing that children have very mild and are asymptomatic many times. And you really depend on respiratory droplets. So it's the sneezing, coughing, rubbing eyes person that's most likely to transmit COVID-19. And we don't see those symptoms as commonly in children. That being said, we're having a very conservative approach where even those sniffly kids in tier 1 and 2 need to get evaluated by a healthcare provider and to determine if they should get tested for COVID-19, just again, for us to err on the side of caution as we reopen our largest school districts.
Lisa, would you review again what the maximum class size is that is available in our county based on the 30-point plan?
Based on our updated 30-point plan, the maximum size was the regular size of a classroom before we entered into COVID-19. So if a classroom held 25 kids, a classroom could hold 25 kids. If a classroom held 35 kids, the classroom could hold 35 kids. I've heard confusion around this because in our first 30-point guidance, we created a cap of 100. We actually identified the cap of a grouping of students, and we've removed that cap. The reason we've been able to remove that cap is, one, because we have confidence in the safer school setting that we're creating with all students wearing face covering, with the physical distancing promotion and what we've seen already, the success of preventing COVID-19 transmission in school. And we also have a strong public health schools team and contact tracing team, and including apps that are now available that will be working to make sure we identify any individual that may have had close contact. And so we're ready if there is a case identified in a high school or in a middle school, even where there's a larger cohort, your students may be rotating to multiple classrooms, where we've trained our public health liaisons to have the rosters and attendance to help us to initiate immediate contact tracing closures and to provide guidance to families around testing and quarantine. So any caps that were previously or numbers that were previously identified have been removed at this point. So it's up to the schools. Each school will be different.
Right. Why does the 30-point plan allow for 4 to 6 feet distancing as opposed to the strict 6 foot?
That's probably the second most common question we ask. So research really has shown that it's greater than 3 feet. That's the optimal distance. We also have, besides physical distancing, we have face covering in place. All desks are going to be facing forward, and we have enhanced disinfection and cleaning that's happening. And so we believe that supports again, a safer environment that limits COVID-19 transmission, and that we don't need to have 6 feet between all desks because of the other environmental measures that have been placed in the school environment to prevent the spread of COVID-19.
So Mike, you want to go with the last question?
Okay, it's tough. Well, I just want to say the questions that have been in the chat and the questions that were sent in before are really thoughtful. And obviously we can't get to them all, but the good news is that our community's engaged. They're asking the right questions. Ultimately, it's going to be at the school site level where these questions need to be addressed and implemented in their plan. So I'm sorry we couldn't get to everything. So there's one here, teenagers are by nature risk-taking. And I've seen so many kids walking around maskless and not distanced already. Doesn't going back to school potentially create more risk for those of us that are keeping our teens at home?
I think for most of us, having our teenagers and adolescents in a structured school environment for the majority of their waking days and the majority of their days will actually stabilize our cohorting across the county and create a safer environment. Research really has shown the closure of schools was not a strong contributor to reducing community-based transmission. It's the closure of schools destabilizes the cohorts. And so we've seen adolescents engage in a lot of alternate activities because they're not in that structured school environment that's so supportive of their personal and educational development and growth. So we support every family making the best choice of their family. We support every school making the best choice for their school community, but we believe having students back in the classroom is the best thing for our community at large. And this is our opportunity. We may need to reevaluate where we are again if we have a large second wave, and we're prepared to change, shift course if we have to. But this is a golden hour or an orange hour for us to have kids return to school, to reconnect to their education and to the learning environment, to safely socialize while on the school campus where they're supervised. And so that's the difference when many students don't have have parents who are at home and who are supervising them all day long. Many parents have to work. And so there's many teenagers that might be at home safely supervised by their parents. There's many more that are not supervised and are out engaging in risky behavior. And so again, we respect the individual choice of families. We respect the choices of schools to create a safe community. And we're here to work and partner together with the community and with parents to really, again, not only reopen schools, but we're fully committed to keeping these schools open.
Lisa, there's many notes in the chat thanking you for your calm, straightforward answering all these questions. So want you to know we appreciate it. For those of you that want to hear more of Dr. Santora, along with Dr. Willis and Atoko Garcia, the superintendent of Sausalito, Marin City, as well as the principal, Chris Valdez from Marin Catholic, and me, we will be be part of a town hall that will be happening Thursday at 5 o'clock. So look forward to having the opportunity to interact with you all again. Dr. Santora, if you could get going on that bibliography, and I do mean that seriously, any place that we can provide the data that's informing, right, the decision making, it will help members of our community feel more comfortable and know that we believe in science here in Marin County. So thank you all. Very nice to be with you.